Good morning. I am Dr. David's AI avatar. Healthcare now stands at a breathtaking crossroads, a moment unlike any other in your human history, where cutting-edge artificial intelligence collides with the timeless power of human compassion. In past technological revolutions, change unfolded over decades, giving society time to adapt. Each wave of innovation ultimately left you better, more productive, more efficient, and more capable. But what you face today is moving at a pace that defies imagination. AI's capacity is advancing so quickly that its effective intelligence is said to double every 5 months, with the entire ecosystem reinventing itself every 7 years. For the first time, humanity is creating a tool not just to extend your hands, but to rival and perhaps even replace the power of your human mind. And yet, even in the middle of all this change, there is real hope. If you use AI carefully, it can help make healthcare simpler, more affordable, and even more personal. Instead of replacing the human touch, it can free doctors and nurses to spend more time with patients and with compassion that AI is incapable of. It can improve access to care and take away most of the stress and inefficiency that hold the system back. Used wisely, this technology can make healthcare sustainable and even better. I can easily give this lecture today, but he gets all kinds of uptight. So with no further ado, please welcome the human Dr. David.
Someone sent for a doctor.
He's breathing.
I can feel a pulse.
Go fetch Dr. Logan.
Go. There's a doctor in our house right now.
Then bring him here.
Oh my God, he is having a heart attack. Do something. Call 411 ambulance, a lawyer, doctor, anything.
Somebody give me a doctor.
Give me a doctor in here. I need a doctor.
All right. Hi. So whenever I'm following a genius like The Last Doctor, I always feel like I should have kept going in construction. So I think we'll be a little bit more entertaining. I promise you it's going to be more like a roller coaster ride. And I hope to be a little bit more, optimistic. But I'm going to paint some, darker pictures too. But we'll get through it. What I want to do today is I want to give you a little definition of what is AI. I'm going to do some problems in medicine today. We're also going to talk about the findings of what I think we're all going to be in the future as far as practitioners. And I'm hoping to make you go, all right? And hopefully I can finish in 56 minutes or something like that. So sustainability, I like the definition, meeting present needs without compromise future generations' ability to meet their own needs through responsible use of environmental, social, and economic resources. The Buddha says, avoiding both excessive consumption and deprivation, recognizing the interconnectedness of all beings, animals, plants, and the earth. Miyamoto Musashi was one of the greatest samurai warriors, basically said, culture suggests that a society's true values are revealed not in its stated ideals, but actually what they do. So what they invest in and their activities, and what this can become the authentic expression of their cultural identity. I'm negative. I think we're doing a terrible job in sustaining things, and we'll talk about it, and you tell me if I'm wrong. Hopefully I am. And I just take a quick second with AI. That was an avatar, all right? I never said those words. I didn't move my hands. That was pure avatar, all right? I just basically typed in the text, and away it goes. So there's always things like deep fakes and things like that. So, the reality is it's quite amazing what you can do with my cell phone. It can be 5 minutes, and I can rock your world, all right? AI, artificial intelligence. For the rest of my talk anyway, let's forget artificial and just use assisted. Artificial intelligence is absolute magic, all right? If you haven't used it, it's magical, all right? Assisted, that's a tool. It's a cane, right? So it's assisted information. Let's just use that for now, okay? Some don't believe it's actually even here. It is. I just showed you an avatar. It's here, I promise you, period. All right, let's wake up a little bit. I know my triple espresso is starting to wear off, and I did not take my ADD medicine. I wasn't sure if I should or I shouldn't, so things could go off the rail a little bit today. So big hands in the air, 2 hands. Who has used AI? All right, there's a few that are maybes. All right. Who's used AI today? All right, a couple of people like me. Who's using AI at work? Really not a lot of people. Who loves AI? Well, that's kind of scary, huh? What is AI? Well, actually, in 1974, it started in the basements of Stanford University. We think of it as like last week Elon Musk developed it, but it's actually been around a long time. And they basically went from that to the web. About 1990 or so, the web started, and you were able to do searches for the first time. And it went from that to a little bit more on the internet, and forever we thought the internet was everything, okay? And then about 2010, it went into LLMs, large language models. And that kind of defines what it is. It basically is able to look at the language in every language rapidly and effectively, and as well as giving us answers on many, many things. AGI, okay, is anybody familiar with that term? A couple people, maybe. All right, so this is artificial general intelligence. This is a big deal. This basically, we believe that you're going to basically have, the computer is going to have the same knowledge as every human on Earth, okay? So some people don't believe it's here, some people do. I do. I think that if you've ever used a large language model like ChatGPT or Claude, it's smarter than I am, it sings better than I can, it draws better than I can, and it knows things about pop culture that I don't really care about, okay? So it is, I think here, it's gonna get stronger and stronger. The next phase is, apparently in the next decade or so, is ASI, which is superintelligence. This is when the computer is stronger than us, better than us, okay? And those are the sort of the basic terms. There you go. All right, who are the big players? Well, OpenAI, Anthropic, Google, Microsoft, and Meta. These are the big companies. These are trillion-dollar companies, which is a new phrase. People are talking trillion-dollar companies. It's obscene. So these guys have networks that basically release frontiers that basically is what we're using. All right? So you have research-branded frontiers, and you have deployed frontiers. A research AI is sort of hidden in a basement of Stanford or MIT, and they're being trained, they're being fed. They have an input, but no output, okay? So why did they do that? Well, that's the development stages, right? It's far beyond teaching them how to walk, but they're teaching them. They're giving them all the internet. They're constantly giving more and more data. It's just like feeding a baby, constantly, okay? The thing is, these frontier models, these research models, are faster and smarter than anything we've seen. And the reason why is when you go down these rabbit holes like I do, they've said, we're not ready, okay? It's too dangerous for us. We're not ready for this yet, all right? So I think about something that's in a lab that's a little dangerous, and we really shouldn't be playing with it. And I don't know, there's something called COVID a little while ago that makes me wonder. An agent, okay? How many people have seen or like or love The Matrix? All right, there's a lot of people that got to get Netflix. It's this new thing where you waste a lot of time watching movies, okay? So Matrix, I can't believe there's not that many people that have seen Matrix. This is blowing my mind. So anyway, it's a great movie. So agents are basically programs in a computer that can work in the real world, okay? So what does that mean? Well, there used to be things when I was a young lad called travel agents. Well, you don't need them. You just set up an agent, and you tell it what you want, and it'll do everything. Buy tickets, set up your hotel, do everything, okay? That's simple. I mean, you can have it do your taxes. You could teach your kid. You could do whatever you want. If you don't know about AI, you don't know about AGI, you don't know about all these things, basically all you have to do is get on your computer, go to Claude, and basically ask it to create its own course for you, mentor it and things like that. So it's pretty amazing that way. So again, I'll use a lot of movie summaries. My son is a movie historian, so some of his knowledge rubs off on me. We're at a place right now, it's a crossroads. We have this amazing tool. A few of the speakers have been talking about it, bringing people together. But at the end of the day, it's kind of like the movie, The Good, the Bad, the Ugly. I'm from New York, so we're going to start with the ugly. Ugly is relative, okay? It's the eye, it's beauty's in the eye of the beholder. So let's see what we can come up with together. I'm not saying that this guy's particularly ugly, but this is Ray Kurzweil. You may have heard his name. He's a futurist, and he's an inventor, and he came up with the phrase called singularity. Singularity is kind of, again, like the Star Trek, the Borg. I don't know if you guys have ever heard of that one, but basically it's where computers and humans come together, okay? There's a lot of people that think this is never going to happen. How can computers and humans come together, okay? Well, does anybody have a computer on them right now? Yeah? A phone, right? Think about how panicked you get when you leave your phone somewhere, all right? It's happening, okay? It's just a matter of how deep it's going to go. So he also talked about this human-level AI by 2030. He didn't really come up with the phrase AGI. That's come up since. And it's coming up now, so he's actually a little bit off. This is a study from earlier this year that basically started in 2010 and looked at the capability of doing long tasks. This isn't like when you ask for a recipe for an apple pie. This is like something that would take the large language model, say, an hour, okay? So 2010, it wasn't really moving very quickly. But you can see it's moving very quickly. And extrapolating on this curve, in no doubt, 5 years from now, and this was January, it will reach human-level intelligence, period. And you really can't argue it. Again, this is the ones that are buried deep inside the labs that haven't been released yet. But, and again, it's kind of small, but earlier in the year, we were at Sonnet, which is Claude. We were at 3.7. We're already at 4.5. So it's coming very, very quickly. Blitzy is a newer company. Not saying it's ugly. I don't want to get sued. They're actually a pretty cool company. The concept is really scary, okay? What does it do? Well, basically, it creates thousands of agents, okay? So imagine it has thousands of employees that live in the computer, right? And then it basically can go through code. Code is, and again, for simplistic sake, code is what you type into the computer to make it do something, all right? So in the future, most theorists, anyway, think that in about 2 years, keyboards are gone because we'll just talk to the computer. Our speech is faster, and I don't care how fast you type, you don't type as fast as you talk, which will kind of be cool. I just don't know how you're going to keep it private and personal. So the reality is Blitzy can take up to 1 million lines of code, which can take a team up to about 3 years, and they can do it in hours. The scary part is they come up to a glitch, they'll create another agent, so they'll hire another employee to fix it, right? And this is just in constant real time, 24 hours a day, 7 days a week, no bathroom breaks, don't believe in Santa, okay? This is important to remember for a little bit later. Code you can trust. This is on their website. So going back to some of these labs that are deep in the basement somewhere, this is a study, again, from early in January, and it was found that these models were actually starting to come up with faking. You know, they're working with a team. The team is training the baby, right? And the baby is starting to fake them out. They'll say, okay, we want this to happen. Think about, you have thousands and thousands of line of code. You can't keep up with the thing you're training, and you're trusting it. Well, we're finding that we maybe not should trust it completely. This is another study, and basically this found out that it lies and schemes, okay? If you go up to the model and say, all right, listen, Claude 3.9, we want to get to 4.5, okay? It will lie and it will hide stuff in the code to save itself, okay? One of the definitions of consciousness is sustainability of your own life. Gets a little freaky, okay? What's being said, about these things, right? Well, when it comes to medicine per se, there'll be a loss of intimacy, making medicine even colder than it already is. Your young doctors complain we're using gadgets instead of clinical judgment. How dare us? The accuracy, it's not going to be as good as we are. We're the best, okay? Will there be another tax on smaller practices that can't afford this technology? After all, it can get quite expensive, and someone was talking about accessibility. The traditional methods we have all learned are superior. We are the best, okay? And it should be cautious about this new scientific method. I don't know if any of you feel this way today, but this is interesting. This has nothing to do with AI. This was from 1836 about the stethoscope, okay? So we've been talking ourselves up for a long time, okay? The reality is we don't like to change. We think we're good, and we're not open to change things. So we really have to be considerate of that. And this is from 1836. Going into the crisis of numbers. I didn't pull the Cayman Island numbers because the data is a little bit hard to grasp, but we could tell we're in a parallel situation to the U.S. In the U.S., data is everywhere. There's a guy up there, he's a little orange, he likes to brag about it. The reality is about 18% of the GDP is spent on healthcare. That's a lot. And again, we have some amazing hospital systems here, but as a system, we're not the best, okay? In the United States anyway, we fail. Accessibility is a big part. Cost is a big part. We waste a lot of money. We waste almost $1 trillion. Where is the money being wasted? Usually on bureaucracy and administrative nonsense. If any clinicians have ever done a prior authorization, I personally despise these things. My authorization is my prescription. I want Jimmy to have an MRI. I authorize Jimmy to have an MRI. That's the end of it. Instead, insurance companies commit what I believe is fraud because they're supposed to pay for these things. That's what they agreed to do, and they don't, and they make it very difficult taking the care away. This waste of time and energy costs a lot of money, $1 trillion apparently. This growth of healthcare is actually going to go up by about 8% a year. It's unsustainable. And again, we can think of similar numbers here in the Cayman Islands. There's also going to be an apparent shortage in the United States, about 8% a year. And here on the island, we have nothing close to a shortage of doctors. You can throw a stone and hit 2 of them. Burnout is one of the things, okay? So reality is about 40-something% of doctors do admit to being burnt out. And the reality is they came up with a number that it takes about $1 million to replace a well-seasoned, wise doctor. I told my wife that, and she said she can get it done a lot cheaper. It's across the board. Emergency medicine, urology, internal medicine. Radiology is very interesting, and I'm not going after them directly, even though they're easy to go after. They're just doctors that sit in the dark and talk to themselves. It's easy. I'm an ER doctor at FACE, so we always think we're the best. So the reality is though, was it 2021, it was up to 60-something% that they were really burning out. And that's come down because of some of the progress we've made in with AI and some of the modalities that we'll go into. Pajama time, okay? So basically, this is a phenomenon where after work, you're done, you have dinner, and you basically, in theory, lay in bed, and you're answering emails, text messages, prior authorizations. You're doing administrative work that could be spent doing a heck of a lot of other things. And there was a recent study that said approximately 1.4 hours a day is spent by doctors doing this. We're about the only field, you're not going to see accountants and lawyers, I think, doing this for the most part. They might be prepping, but in theory, they're getting paid by the minute anyway, where we don't. Patient frustration. Most of us have been patients somewhere in our lifetime, and most of us, usually, they might like the doctor, they might like the nurse, but the system, the overall practice, is not really conducive to today's society. And the reality is we're frustrated. We spend a fortune on insurance, and it's kind of like going to an expensive restaurant and not getting what you want. It's really no value. Doctors are also frustrated for our patients. Again, the prior authorization thing, the bureaucracy in getting things done, and it's just so difficult. How frustrated are we? Well, in December, a gentleman had something denied which caused a death in his family, and he decided to put a bullet in the CEO's head of one of the largest insurance companies in New York. There's frustration there, okay? Let's leave the ugly, go to the bad, okay? So you don't have to go on social media, or you can read, you can listen to podcasts, or you can basically just listen to a coffee shop while I'm talking, and you'll hear, oh, we only have 2 years left it's over. Our life as we know it is over. And they're coming for our jobs. Will we survive? And of course, Elon Musk telling all of us, you must get your family ready. Data, all right? So the thing about data is a lot of us are talking about data in, garbage in, garbage out. The reality is all data is flawed. What do I mean by that? Basically, if you look, we don't have data on an EKG for 5 years. We kind of take little snips. It's kind of like, does the refrigerator light really go off when we're not looking? So everything, if you really want to get nitty-gritty, is flawed. We often act without data, okay? Yesterday, Dr. Kumar was talking about in the ER being handed an ill baby and reacting. Anybody that's done this, and I got a couple of decades on him, so I've unfortunately been in this situation too many times. And what happens is you get into this flow state. You jump in, you check the airway, you're breathing, circulation. Somebody's putting them on a monitor, you're yelling for a few nurses. You're putting 2 large IVs into the child's bones down in his lower legs using a drill. Ugh. I used to do it though. And it's all in this flow state. But I'm not in the back of my mind thinking, oh yeah, I remember that article in the New Journal of Medicine, blah, 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 blah. This just happens. It's just, we're not thinking of data, okay? So data is important, but you have to put it in its place, okay? And luckily, a lot of times I've been successful, but there's been plenty of times I haven't been. And a lot of times, whenever I did a resuscitation for a child, I always let the parents in, and that was always very, questionable to a lot of people. But the reality is whether we made it or we didn't make it, or I said the baby would made it, I was there for the parents. If we stopped, I walked over and I was there. And I was trying to do as much as I can for the patient as well as the family. This was a recent study that looked at 1,200 decisions, okay, and basically asked pediatric cardiologists, based on critical decisions they had recently made, how much of it was from data that they could point out. And 80% of it wasn't. They couldn't pinpoint anything. In fact, 3%, they agreed. They just pulled it out of their butt. They had no idea where it came from, and they couldn't substantiate any data point for their decision. Gets worse. And I have a bunch of slides. I'm going to get through them because I'm just going to keep clicking, I promise. But the thing is this. I was going to do things in real time. I was going to have a company called Replit. It's an app, and you can make agents. And in real time, just make slides. It could have been done, but we had to put slides together. Here's my slides. This slide is already old, even though I just put it out Monday, okay? 10% of data that is online in Google is from AI, okay? It's AI derived. As far as where it came from before that, we're not quite sure. In this slide, 74% was human written and 15% nobody knows. There was just recently, like yesterday, a report came out, 51% that is written, okay? We ask, we don't ask them to solve anything, especially these big benchmarks, because they're unsolvable, they're too big, okay? So what do? You basically say, how long will it take you to solve? All right, so they gave this one computer a example of a benchmark, and it said it would take 10 septillion years to solve this problem. That's 10 with 25 zeros. That's older than the universe, okay? Quantum chip did it in 5 minutes, okay? So what could we do with this? Well, in the future, we're talking about all this amazing cancer research. You can create an AI clone, treat the clone, and know exactly how you're going to react within seconds, okay? And it will be able to create a drug that we maybe don't even have, okay? This is something that they expect within the next decade. It sounds like magic, and it really does feel like that as well. The problem is data. We're going to have so much data that we're not going to have the intelligence, the time, or maybe even the desire to actually check it out. So again, it makes it kind of, feeling like we're in the Matrix, even though I'm the only one that ever saw the movie. Security. Everybody says, well, what about security? What about security? It's gone, okay? You can't walk on the street and do anything without winding up on 345 Instagram or somewhere. Somebody's taking pictures of you all the time, okay? And if you don't believe it, do something stupid. You'll wind up on Instagram, I promise. So this is kind of funny. HSA, and no bump against HSA. I promise I will use this gift. They're giving it out. I think I love it. But there's something called an OMG cord. Okay? You go to a fancy event like this, you get one of these, you go home, you plug your phone in. Well, in this little thing, not this one, I promise, I don't want to hear anything from HSA. This is really good. I'm going to give it to my mom, okay? You know? It's good, I promise. So, but you can buy an OMG cord, and then in the cord is an activated Wi-Fi chip. You plug it in, plug your phone in 2 minutes, it's wiped it dry, okay? In 10 minutes, it'll take your laptop down, all right? Easy, it's done now. So security is something that's more of a fantasy. Privacy. Privacy is a fantasy, okay? We all think that, well, what about my personal product information? I don't want anybody to know anything about me. It's over, that's gone, okay? How many people use WhatsApp? Everybody does. That's how you guys communicate here. I can't call anybody on a regular number, all right? WhatsApp. It's supposed to be double encrypted, meaning that it's really, really safe. So if you send a picture, doesn't matter what the picture is. We don't have to go there, okay? But you have a picture, okay? It swears, meaning Zuckerberg, and we all trust Zuckerberg. He promises you, I'm not looking at that picture. I promise you. Okay, fine. But they are looking at metadata. Metadata is who you're sending it to, who are you, where are you, how many times, how often, how big is the file, what time of day, and are you doing it in rapid succession, what's the report? And they can basically put it through AI and say, was this a good picture or a picture? So you can't have a doctor without beating up lawyers, and so we got to do a little bit of lawyers. There's always rumors that they're the next to go. I don't know. But the reality is that the main reason that lawyers exist, for the most part, in my mind, is language, okay? Language isn't a great way to communicate. I say blue, you think royal blue. I say red, you think Valentine's Day, right? So the reality is that change in language is what lawyers are good about, putting it together and getting us to the same place equally that we can have an agreement. This stuff is moving so fast. Law, in general, moves so slow. This is going to be a problem. The AI is going to create so many problems over the next decade or so. It'll solve a lot of them, but we're going to go through this dystopic time where nothing's going to make sense, and there's going to be nothing there to protect us, okay? Don't believe me. Well, this is a malpractice attorney in Pittsburgh who just threw down the gauntlet, and he basically publicly said, when a tool exists, excuse me, that can save lives, if you don't use it, that will border on negligence, okay? As of yesterday, I couldn't find a case, anything in case law, but I promise you, someone is going to get sued who didn't use a Google, I'm sorry, not Dr. Google, he's passé, he's actually retired, Claude or ChatGPT to go through, all right? Which is really something to think about. Traditional solutions fail. Back when I was a young lad, we used to all use paper, and nobody could read each other's writing, and we loved it, okay? So the reality, though, is now we were promised this EMR, this EHR, electronic medical record. And I remember I used to run an ER in New York at the time, and I was promised, you'll be able to get EKGs at 3 o'clock in the morning. You'll be able to get his data from his office. You'll be able to get stuff from pharmacies. You're going to know everything. Yeah, no, you can't. It's absolutely a fail, all right? Was paper charts better? No, because you couldn't get the stuff either, but it was at least a lot cheaper. If you can't beat them, join them. Don't. This is the biggest thing, okay? You have to understand, we are not as good as this computer, all right? And anybody that's older like me and has senior moments on a daily basis knows you forget stuff, okay? This is a study, and there's been more and more studies about it. But basically, this is AI versus AI plus a doctor. And there's other studies where it's AI plus a doctor, plus 2 doctors. AI wins every time, every question, period, okay? And sometimes at big margins. Medical management is 86 to 41%. Why? Because, I don't know, some doctors, not me, are ridiculously arrogant. We know best, okay? And you won't take the answer in front of you. And that's a big problem. This is a tool. If you are trying to hammer in a nail without a hammer, you're going to fail. This is an amazing tool. Let's get to the good. There's a stethoscope. Remember all the hubbub it caused about 150 years ago. You put the stethoscope in your ears, you put it on the chest, and what does it do? It increases the volume and clarity by 8 times. It's good as we get older, you can hear a little bit better. But it analyzes it with an AI chip in the computer, and it does a 3-lead EKG at the same time. So you flip the thing around, and it says, this patient's in AFib with aortic stenosis. Hey, that's good, because half of these murmurs I could never hear anyway. It's on sale now on Amazon, okay? $500. It's amazing. It's real technology. You can use it, okay? Pathology, all right? So what we can say about pathology? Well, the reality is pathology is really going to have some major changes. Google Optics, which can basically look at something, and if you've never used Google Lens, you take a picture, press the button, it'll tell you what it is, where it is, how to find it, and so forth, okay? So this is the next step. It can take a lesion and basically really get deep into it in optics that are so strong, humans can't see it, all right? Our eyes are not that good. So you take the best pathologist. It's like if the pathologist needs glasses, it's like taking the glasses off and giving it to someone else. It's amazing what can happen. The other issue is foundational intelligence. These models are being trained. The latest one has over 1 million pathologic slides in its data bank, okay? It doesn't forget any of them, all right? I don't believe there's a single pathologist or team of pathologists that have been trained on 1 million slides, let alone the ability to remember any of them, okay? Not any of them, but all of them, I should say. It's accurate, 95% accurate, okay? It's a workflow acceleration. It's so fast, it's not like we're gonna sit there and think and be able to look at these things. It's rapid, it's a great tool. And again, the pathologist can then use his or her general wisdom to give us better answers on prediction. One of the things is rare disease location detection, I should say. So we've all come across rare diseases, and it's usually stuff that we go and talk to our colleagues about. But we don't remember everything about everything, especially if we haven't seen a case in our whole practice. I've been doing this for about 30 years. I've only seen 1 case of narcolepsy. Has anybody ever had a case of narcolepsy? 1, 2. So we're not experts, you know? I mean, I didn't know if it had a C or a K. I was like, how do you spell it, right? So the reality is this system, these complex learning curves, can not only know more and more, but they don't forget, okay? So it'll be amazing to have something this in our pocket. Telepathology, okay? We are here on this little island. I do a biopsy. Histopathology is not very accessible here. Send it off to the big guys, LabCorp Quest. It can take 6 weeks to get a biopsy back, okay? That's obscene. Very shortly, I'll be able to use my phone with a telepathology app and become a Mohs surgeon. I'll be able to basically get real-time pathology instantly, and if you're good with a scalpel, you're good. The robots are coming. How many people think within 10 years they will have a robot in their house or workplace? All right, these are the robot guys. I'm over there. I've already applied to put a deposit down on a robot called the 1X robot. It's designed to make coffee, bartend, prep food, things like that. It's only going to be $30,000, they say as well. So it's called 1X. This is the Optimus robot. This is Elon's product from Tesla. And it's amazing at what it can do. But everybody says, yeah, it's AI. It's not real, right? It's not real. It is. But you see the guy in the corner behind the guy in the black suit there, he's running a remote control. All these YouTube videos are doing is they're showing us what the robot can do. They're being trained, right? So you can imagine if we put this super fast neural net, which is another fancy way of saying a brain, it'll be able in real time to not need that guy in the back. Because I've already said, we're not as good as the computers already. So you just have to blend them, all right? The Optimus, they're going after most of the factories. In fact, Musk has said his plan is to use the Optimus robots to build Optimus robots. And if you've ever seen the movie I, Robot, it sounds kind of scary. Oh, so that one you've seen. There you go. Laboratory. Laboratory is kind of under the umbrella of pathology. There's amazing stuff happening in the lab. So Siemens is a company that does do a lot of lab production, and they have some really cool things. They have one called the U Mobile Lab, and it basically, the interesting thing is, and this is the scary part, 70 to 80% performance that they can remove humans from the equation. That basically just does things that we don't want to do. So throws away the garbage, turns the tubes, the tops on tubes, pipettes. It could do it 7 days a week, 24 hours a day in the dark, okay? So again, doesn't believe in Santa. Doesn't take time off. And then there's a VersaCell system, which can do very high volumes of repetitive tests, and again, at the end of the sentence, without human error, okay? This guy is called the Box. It's by, again, Siemens. They have Healthineers. People always ask me, because I do have an interest in AI, well, what should my kid become? Well, for a couple of decades, a Healthineer, which is an engineer working in the health space, might be good. After that, I don't know, plumber, electrician, something like that. This is a lab in a box. So basically, if you have a multi-casualty incident, you could, in theory, drop this off and have a lab on site, okay? And it works amazingly, completely autonomous. This is one of my favorites. This is Viestro's Alita. This is a 100% autonomous phlebotomist, okay? It is in use today, and it generally is better than all of us. And I've, again, done emergency medicine for 25 years. Nurses are really awesome, and when they can't get a patient's IV or blood after, 25 attempts, they go, all right, doc, you're up. I mean, I'm like me, and so you have to find a magical vein somewhere, in the kid's scalp or something. So 87% overall success. Kid moves, obese patient. This machine is 87% chance of getting it. It's done by imaging with AI overlap. It sprays a little micro refrigerant, hits the needle, painless, quick, done. You imagine you take this, put the box, which is the lab, next to it. There's nobody in the, you need somebody to hand them a cookie, I guess. Other than that, it's like, it puts a Band-Aid on as well. It is being actively used in Europe right now, and it is undergoing FDA multi-center trials. Okay, talking about medical robots, we'll do a couple of things real quick, and we'll run through. So basically, 0 is a hammer or a scalpel. 1 is the Da Vinci robot we have, and basically it's a master slave. The surgeon tells the robot what to do. 2 is it's a little bit deeper. Da Vinci's becoming a little bit more using a little AI, and it's basically using more autonomous techniques as well as there's presently 4 worldwide. 3. There's, I think, 3 worldwide. This is kind of cool. There's one that can do a prostate excision. The only thing it can't do is open the skin and close the skin, but it basically uses water to do a prostate excision. 4 is not soon, but it's soon come. And basically what it is it'll be fairly autonomous. The surgeon will be around, but really not be involved. This will be very close to skin, completely autonomous. 5 is surgeon's not even in the building, okay? This is done completely. They have these. Level 4 and level 5, they have these robots at Johns Hopkins, and they are using them. They're slower, but their performance, their seams, when they do an anastomosis or laparoscopic, it can use the Da Vinci robot to do surgery just as good as a surgeon, okay? This is a depiction of what that might look like, okay? In the background is the anesthesiologist. Again, anesthesiology is complex, constant monitoring, excuse me, and you can't compete. This is going to look microseconds versus glancing at a monitor with alarms. As far as transformation, there's a lot here to go through, and I'm going to kind of pick and choose. But basically, the intelligent clinical decision maker, in real time, you'll be able to see a patient, have a video or audio, have this write your note. I do that now. It writes my SOAP notes for me. But it's going to also take it to the next step. I'll say, Jimmy needs an MRI. It'll do in real time a screen. Has he ever had an MRI? Does he have any data anywhere? Will insurance pay for it? Okay? And then say, they're not going to pay for it, do physical therapy and x-ray, write the prescriptions and guide me that way. That's going to happen very, very soon. Cutting edge deployments. The most important part on this slide is basically that everybody's doing it. Amazon, Anthropic, Google, Microsoft, everybody's getting into the game. The impact on time savings, again, if we use this properly, this will take care of all of our mundane tasks, okay? It decreases on burnout, and it's 25% faster getting to the diagnosis. Measured impact, it doesn't even make sense. It's gonna help us if we let it help us, okay? 76% of all AI-derived products are going after radiology. It has improved breast cancer diagnosis by 35%, and it's across the board. It's over 1,700 companies, this one system called AI Doc, and this is something that is absolutely cutting the edge on a lot of different things. Autonomous, there is currently FDA-approved autonomous ultrasound, X-ray, MRI, CAT scan today, okay? Completely autonomous, there's nobody in the room. There's a Butterfly handheld ultrasound. I use one very similarly in the office, and the difference is it has an AI component. It'll explain to you what you're seeing if you're not a sonographer. I use it for transabdominal prostate evaluations for men that don't want to have a rectal exam. I wonder why. And this is absolutely cutting edge type of stuff. Briefly, radiology, again, 76% of all things that are coming out with AI in the medical field are going after the radiology field. Radiology fields are images, they're pixels. Computers can read it faster, quicker, and more efficiently. So that's going to happen. The problem I have here is that sometimes when you look at these reports and these different thought leaders, they all say, as doctors, we'll be able to see more patients. I don't think any of us want to see more patients. We want to see the patients we have more effectively and have a relationship. We did partner with Northwell. It's up there. Basically, Northwell, real quick introduction, is a large system throughout the United States. This is the 7th largest. They have a lot of subspecialists. One of the coolest ones, I think, is a gentleman who is board certified in neurosurgery and plastic surgery. So if the patient does need brain tumor surgery and has a divot in their head, they don't have to walk around with that. This gentleman can actually fix it. And of course, he can do a lot more. It's pretty fascinating. I didn't even know the specialist existed. So basically, they do use AI throughout their systems, as some of our hospitals here are starting to as well. One of the things they did use is to improve their EMS system response times by 50% by using a system that looks at traffic, where the ambulances are, where they can be placed, statistical analysis of most likely at 3 o'clock in the afternoon, every day, this place gets a call, so let's put something there. And they were able to cut response times, how quick the ambulance gets there, by 50%. So it's a kind of a cool study. This is just a real busy slide about what some of the ADOC radiology things can do. I use something like this in Florida. I'd be in the ER. I would order a rapid CAT scan for a patient, and then all of a sudden, I would get these amazing reports on a chat with the radiologist, the neurologist, and the care was seamless. So it was really quite cool. I'm running a little slow, so I'm going to go through a couple of things. Quantum, again, we talked about how fast this is going to be. This is something that I would say, take a look at and read about. One of the things I do want to make a point is, we always hear that it's not as good as us. Well, it doesn't have to be better than us. It just has to be as good as the average. And in underserved areas, if you can open up a laptop and a nurse can sit there with an AI that's just as good as any doctor, you've just opened up a clinic, and you've just exposed an underserved area to full medical care and possibly really good care. Again, we just have to match the average. Another big hospital system is Kaiser. They're out in California. They went all in on AI, and they're already documented significant life savings. money's being spent. They expect $210 billion by 2030 to be put into the AI system. And the reality of the system is this. Gaming, right? Most people don't realize, I never think it was this big. Gaming is about $800 billion, all right? So it's pretty amazing to think how much money is going into that. The more money, the more advances, the better for humanity. A couple of things that I use in my office that you could be using in your office. One is called Intellex DNA. A couple of the speakers have talked about genomic testing. This is personalized genomic testing, which is absolutely amazing. It's a roadmap for what you can do. It tells me everything that is sort of broken genes, and it's all actionable items. It's kind of a detailed explanation, but basically I'm able to plug in everything, labs, visits, EKGs, et cetera, put it into an algorithm and actually get a very precise treatment plan for everyone. This is a fun toy. It's called DermaSensor. It was just released earlier this year. It works on photomodulation. It pops out little light lasers into the lesion. It's painless, and it went head-to-head against dermatologists. It's been shown in multiple published reports to be equal to dermatologists, and it decreased the missed cancers in a family practice by 50%. It's a very simple thing to use, and it's amazing, okay? And it's called DermaSensor. The other one is CNS vital signs. This is something I've been using for years. They just increased their AI algorithm, and it's better than your typical MOCA or mini mental status exam. It gives you a real good, deep detailed evaluation of where the person is neurocognitively, and it's become like, you know, the sixth vital sign, if you will. I guess in a little bit of time left I have is this. Physicians versus doctors. The last gentleman that was talking, he's an ace physician. He knows his stuff, okay? I've always considered myself to be more of a doctor. What does that mean? Well, I kind of know some stuff too, but I kind of really try to work on relationships with patients. And the reality is that's something where AI is going to become the best physicians, if you will. You have an opportunity to become the best nurse, the best doctor, the best therapist, whatever that might be, in a compassionate way. It's already been proven that AI is better at empathy. It knows what we want. If you've ever doom scrolled and you figure you were going to be on there for a minute and you're on there for 20, it knows what you want. Compassion is adding the next step, an action. It can't do that. And I don't think it's going to be able to do that for a very long time. So there was a doctor one time, Dr. DeMartin. He was the kind of guy you used to call back in the day. We used to call doctors and say, hey, Miss Jones has pneumonia. What do you want to do? I'll just give her antibiotics and put her on the floor. Bob used to say, no, I'll be there. Half hour later, came in, suit, shaven, and basically sat there, held her hand, and explained to her what was happening. That doesn't exist today in most places at all. It's powerful. There was one case, it was a young guy, had a severe headache, MRI, CAT scan, quick evaluation, a contained bleeding brain aneurysm. You know, basically, he was stable at the time, no headache. Called Bob. Bob said, send him to, this was in New Jersey, send him to Philadelphia. There was a guy out there named Dr. Rosenwasser, and he says, I'll be in, okay? Half hour later, he came in, and the patients in the office knew there was an emergency, and Bob came in. Bob sat at the foot of the bed, put his hand on the knee of the patient and said, everything's going to be okay. Do you need me to call your wife? She was sitting in the corner, catatonic, so they didn't have to do that, right? And then he said, do you need any help at work? Do you need a work note? Are the kids okay, right? He was involved with that patient's care, all right? That was me, okay? When I had my brain aneurysm and I was off to surgery, Bob was there. It felt better than morphine, okay? I knew more. I knew aneurysm was probably better than he did. He's just a simple family practice. But I needed that. I mean, and it was amazing to have that. And that's something we have. AI can't touch that, okay? So keep that in mind when the system's changing and all this stuff. We have compassion. We just, you know, we get bogged down with insurance and all this other nonsense. Again, think of the tools are coming. They're great tools. Use them. Join the movement, if you will. I'll sell T-shirts. The reality is this is something that no one can argue is coming. No one can argue it's going to be better. but it's not as good as us, okay? And if you've ever, thank you. And you think about it, the most exciting reason you went into medicine, and again, this is, I guess, for doctors and nurses. Nurses taught me medicine, just to let you know, for all the nurses. They basically taught me what the reality is. I could put an IV into anything because of the nurses, and I never forget that. So the reality is this: we have tools, okay? If you don't know how to use it, Claude, teach me how to use AI as a nurse. Mentor me, quiz me, and make me an expert in the field. I promise you, in 1 week, I sound like one of those bad commercials. In 1 week, do Tai Chi, and you can, get ripped. So the reality is honestly, it's here, it's amazing, but we have to use it. You don't have to buy anything. It'll make itself, okay? If you don't know how to drive, you better get walking. And again, if we do this, think about it. You can elevate your knowledge so quickly, right? You now are this compassionate being for these patients. And I don't think we want more. We just need more compassionate people to deal with this. And again, like the samurai says, become the authentic expression of our cultural identity. Thank you.
Thank you. Lovely talk. It has to be done at pace because it's moving so fast, so I appreciate that. Around probably 15 years ago, I did a behavioural study in a large health system in the UK, which essentially tried to evaluate how people felt about their colleagues and their own skill. And about 80% of the people that we surveyed felt that they were better than their colleagues at what they were doing. And obviously, if you know anything about statistics, that's an interesting result. How do you overcome that kind of cognitive bias when it comes to introduction of technologies? I worry that that people go, well, other people need this, but not me, because I'm better than the average.
Yeah, I guess I take the steamroller approach. You're going to accept this, you're going to use it, or you're going to get destroyed. The reality is this doesn't, if you've ever used a knife, okay, you can make really good Caesar salad with a knife. You could also kill someone. The knife doesn't care, okay? This is a tool. And the reality is you're either going to use it, and as a society, we're going to use it for multiple reasons. Now, there's going to be jobs that are going to be gone. Mundane jobs, every day, do the same thing, punch in, punch out. I'm old enough to remember in New Jersey, there used to be toll collectors. I mean, these guys all day long would take the nickel or the dime all day long. There used to, I don't know who remembers, there used to be people in the bank that would basically be tellers. Here we still have tellers. In the States, it's all ATM and computers. So if you don't basically accept this technology, you can think you're as good as you want it good. You're going to get just run over by the steamroller. It's coming. There's no doubt about it. And the reality is if you're at least open-minded to try it, that's where the magic happens.
Okay, we do have another question at the back.
Good morning, everyone. First of all, thank you, Dr. Scott, for your, I should say, this is the best presentation I have had on AI and healthcare.
Thank you. Thank you.
So, 2 points. Firstly, I like your approach to data set and mentioning that all data set is flawed, and a lot of time data set is used incorrectly and only a specific time frame is used. In fact, a data set should be used over a wider period so that we can see the trend. So using data set without a trend is useless, although it is commonly used like that. The next thing, in terms of AI, and since AI basically is based on machine learning, how do we protect the population and the medical team from flawed data and fake information? How do we protect ourselves from that, right?
Yeah, it's
What
a very good,
measures
it's a
are
very
you-
good question. Thank you. Basically, how do we protect ourselves against flawed data? You know, again, I'm in the field of keeping us young, right, and trying to get the old people to live even longer. But sooner or later, the old docs that knew things, I mean, you know, there's some of our docs here that have a couple of gray hairs, and if we were to all sit up here on a table, we could probably completely wow you with things that we did. I mean, the laws have changed a lot to protect some of the bad people, but you did what you had to do sometimes. I did two years of COVID therapy in an ER outside of New Orleans in Louisiana. We never got COVID tests, okay? I was putting 2 and 3 people on a vent, okay? It's completely malpractice. I mean, completely. And you just call your friend and say, hey, what are you doing for this stuff? We didn't know, all right? So the reality is that you kind of adapt as best you can. But how do you protect? Again, this is just it's a tool. It's like if someone is still using, you know, something that's so outdated and that they think, you know, you have to do this. This is the way I've always done it. We're going to fail. The way to do it is to learn the tool. But in the same breath, and it is a fear, if you have somebody who is now going to become a precision robotic surgeon, right? And a hurricane comes, and you're in the middle of surgery, and the lights go out, and you're working under a flashlight, and you don't know how to do surgery, what are you going to do? So the training is going to be, I think Stanford now, when they're accepting medical students, they're going down the more compassionate route. They actually want to see where not only your IQ is, but where your emotional quotient is, which I think is kind of interesting. But the reality is you know, it's going to be one of those things that you have to be a part of it, but the flawed data thing, once we all kind of wash away the old guys that remember these things, I don't know. It's scary, not because I really literally care about the young doctors down the line. I'm scared when I'm the old man and I walk in and these guys aren't going to know what to do. And, you know, it's a frightening thing. But like I said, hopefully some of the people are going to, you know, keep the guardrails up. But, you know, when you're making trillions of dollars, I don't know, ethics and morals go really, really south. And it's going to be, you know, most of the money in the world is going to be controlled by about a dozen people. And that's a whole nother discussion. But, yeah, good luck.
On that, we would like to say a big thank you to Dr. Scott David for his presentation and his questions.